evening to everybody, and welcome to the first of 5 meetings where we will be talking about the administration of the new vaccine. Now, as you all know, over the about the last month, there's been lots of discussions around vaccine hesitancy. And so what Birmingham City Council have decided to do in conjunction with the CCG and with primary care and with the NHS, we've decided to put a series of sessions together so that some of those difficult questions that at times people don't want to ask, but they feel silly to ask them, but they want answers to those questions. Now, before Christmas, we knew this might be a little bit of a problem, but since the new year, it has become a little bit more of a problem where people have become very hesitant. Now, to save on time, I'm going to throw in a few questions. Some of the questions we've been asked are around, why was the vaccine developed so fast? Why should I get vaccinated if I'm not in an at-risk group? Why is the vaccine being rolled out before we know its long-term effects? Why can't I choose which vaccine I get? That's just a sample of the types of questions we've been getting. Now, tonight, we've got 3 wonderful speakers, and I've got it wrong. We've got 4 wonderful speakers. Marion Gibbon is the first speaker, and she is from Public Health in Birmingham City Council. We've got Dr. Rahul, who will introduce himself when he speaks, from North. We've got, is it Clara or Clara?
It's Clara.
Oh, brilliant. We've got Dr. Clara Day, and Clara is also here to speak, and Dr. Peter Ingham, who I've known for years, and these guys are wonderful. They will answer all the questions you may have. I'm just the cabinet member for adult social health and care, and I'm here to chair the meeting tonight, Paulette Hamilton. We're going to be recording the meeting, and what I am asking is, for those of you that want to ask the questions in the chat box, you're welcome to do so. Those of you that want to ask the questions by putting your hand up, you're also welcome to do that. But can I ask that the questions be concise and to the point, because we have a lot to get through in a very short space of time. So what I'm going to do, I'm going to bring Dr. Marion Gibbon onto the call from Public Health, and she will just give an overview of what's going on. Marion, over to you. Thank you. And while Marion is coming on, I'm not sure where she is. But
sorry.
Oh, thank you. While she's coming on. Okay. 1 second. You do what you're doing. I was just going to say to people, can I ask you to please keep your cameras off and also mute yourselves unless you're going to. It just makes it easier. So please mute yourselves and keep your cameras off. Are you ready to go now, Marion?
I just need to open the PowerPoint because I had to go onto a new laptop because the other one's just stopped working.
Are you able to start, Marion?
I'm trying to open my emails to get the PowerPoint up.
Would you like me to get Dr. Dubb to say a few words first while you're doing?
Yes, that would be brilliant. Okay. If I can do that.
Dr. Dubb, would you mind coming in, please? Thank you.
Hello? My picture's gone.
That wasn't me. Hello. Hi.
Oh, the host has stopped our video. Okay. Sorry about that.
Can I ask those who are listening and they're not actually participating in the speeches to please turn their cameras off and also to mute themselves, please. Thank you. Over to you, Dr. Dubb.
Hi, My name is Rahul Dubb. Thank you, Paulette. So I'm a GP in the north of the city in Sutton Coldfield. We are part of Sutton Coldfield Group Practice, which is a 6-site but single practice. We look after 52,000 patients, but in our COVID vaccination program, we've taken on the responsibility of looking after our neighbouring practices, and so are looking after 96,000 patients. And we're running our vaccination program. We initially started it as a wave 1, so first wave of practices, and we started that in December. And we've currently done over 10,000 vaccinations from our Falcon Lodge site. We've recently moved into the Sutton Town Hall, and that's through a collaborative approach with working with University Hospital Birmingham, the Clinical Commissioning Group, the Town Council, and together with the Royal Town Hall, we've got a program together which has enabled us to do more and more quickly. So that's just a brief introduction from myself. So I think you're muted.
You're on mute, Councillor Hamilton.
Thank you. Marion, are you ready to go now? Marion?
I think she's having some difficulties, Paulette, because
okay, thanks,
yeah.
Gemma.
I'm
Peter,
not sure
would you like to say a few words?
Thank you, Chair. Yes, just to say that I'm Dr. Peter Ingham. In fact, I work with Raoul within Sutton Coldfield Group Practice, but I'm also, I've just stepped down as Chair of the CCG, and I'm working now with UHB in the COVID vaccination programme, and work with Clara closely during this programme. That's what I'd like to say. Thank you.
Thank you, Peter. While we're waiting for Marion, Dr. Day, I'm really sorry, but would you like to formally introduce yourself? Thank you.
Yes, hello, I'm Clara Day. I apologise, just dogs stress at the same time. I'm a kidney doctor at the Queen Elizabeth Hospital, but I've been involved with leading the medical support for this vaccine programme over the last, goodness knows, it feels about 5 years, but it's actually about 3 months. And it's been an absolute pleasure really working to get the whole of Birmingham and Solihull and Sutton working together to deliver this. So I'm very happy to answer any questions.
And I'm delighted that you can join us, Dr. Day. Marion, are you ready to go? Marion, can you unmute yourself, please?
Yes.
Thank you.
So I'm ready to go.
Okay, can you get started, please? Thank you.
Yes. Host, please, can you let me share my screen?
Marion, I'm not sure I can at the moment.
Oh, right. I'll try and do it by
Why don't you just give us the highlights, Marion?
yeah, okay. I'm going to go. So basically what I had to share with you today was a presentation, and that's I've been thwarted with, so I'm going to just try and share the highlights from having it open on my other screen.
Marion, do you want us to give you a few minutes to sort out, and we'll start answering a few questions? Are you able to go?
Yeah, that would be great.
All right, okay. Right. Gemma, I know that we've had a few questions come up on in the chat box.
Yes,
are you able to read a few of them for us?
Okay, I'll take the first three.
Okay, thank you.
So this is from Tony, Tony's asking if he can have the COVID vaccine if he had the flu jab last week. And the next one is from Janet. She says, is anything being done to address the chaos we experienced at Millennium Point on Monday? And the third question is from TW. Will school staff be vaccinated in Birmingham City Council?
Right, so can I start with you, Dr. Dove, please?
Yep. So if you have had a flu vaccine over 7 days ago, then that's absolutely fine. If you're in the group that is eligible for the COVID vaccine to have it. So you've been over 7 days. So the short answer to that is yes, if you are in cohorts 1 to 4, which is the groups that we are vaccinating now. Does that answer the question for that particular person?
Yes, it does. Yeah, thanks.
Thank you.
Paulette, you're on mute.
Can we have an answer to the second question?
Can you remind me the second question?
So I think this is one for Clara or Peter. From Janet, can anything be done to address the chaos that we experienced at Millennium Point on Monday?
I'll take that one. I'm sorry about that, Janet. Do you want to expand a little bit on what happened?
Yes, I'm happy to actually. It's called Janet because I'm using my wife's computer. We had an appointment at Millennium Point on 11 o'clock on Wednesday, well 11:05. We turned up at 11 o'clock and there were lots of people milling around. We joined, first of all, a walking queue. We were then put into a holding area, moved from there into another holding area, moved from that holding area upstairs into another holding area, then into another holding area, and finally we had our vaccine at about 5 to 1. So we were about 2 hours in Millennium Point, and I must admit, if I knew I was going to wait for 2 hours, that's fine. But what really upset me, and my wife as well, was that we've been shielding ourselves pretty religiously for 4 months now, hardly speaking to anybody. You get to Millennium Point, and while the staff there were doing their best, there was just so many people that social distancing was difficult. And basically, it was just a very unsatisfactory experience. And I must admit, while the vaccine, once I got to the vaccination point, that was fine. I would encourage everyone to have a vaccination. But my wife's had a slightly sore arm. I felt a little bit woozy yesterday, but I'm fine now. No problems at all with the actual vaccination. But the point of getting to the vaccination was absolutely appalling. And what worries me at the moment, I am actually quite worried that in attending that vaccination clinic, I might well have caught COVID, because obviously there are people there, you know, there were 200 plus people milling around, and statistics suggest that at least a few of them will have had COVID. It just was a very unsatisfactory experience. I could go on, I could explain longer if you wanted me to, but I think that's enough.
Thank you for that. Thank you. Are you able to answer that, Dr. Day? I don't think you are, to be honest. That may be something we have to take away.
I think, you know, I'm very sorry that that was the experience you you had there. I think if you, I'll get Gemma to give you some contact details to be in contact with us, and we can perhaps try and take that a little bit further for you. I'm very sorry that that was your experience.
I will put an email in the chat, so keep an eye out for that, okay?
Thank you. And the third question, before we try to bring Marion back in.
So it was from TW, and he says, will school staff be vaccinated in Birmingham City Council?
Are you able to answer that, Peter?
Yes, school staff will be vaccinated, but we are at the moment, we're going through a process to vaccinate individuals in order according to the priority that has been put forward to us by the Joint Committee on Vaccinations and Immunisations. So the cohort of vaccination will follow in the near future, and we're pressing through at the moment with the very frail, the elderly, and those that are have existing conditions, serious conditions, and we're pressing on and accelerating through those, but we will move down the cohorts and into other groups in the coming weeks, so it shouldn't be too long.
And just to add to that, we've been told in Birmingham City Council that teachers from special schools will now be vaccinated as part of that 1 to 4 cohort. That was agreed by government, and we've sent that out to our special schools, but teachers at the moment are not in that first four group. What I'm going to do is hand straight over to Marion. Marion, are you ready to go now? Can you unmute, please?
Yeah. So the first part of what I've got to share is about testing. There's 3 kinds of tests that are undertaken for COVID. There's the PCR test, which tests genetic material. And then there's the lateral flow test, which is the quicker test that's done, that you get the results the very same day. And the third kind of test is an antibody one, which we don't do an awful lot of. Then we've got 100. The NHS website has now got symptomatic testing where the sites are. And I would have been able to share a map with you, but that's not possible, of course. And there are also lateral flow tests available now across the city, and in various different places, which all will be available on our website, and to show you where those sites are all available. The lateral flow test, you get the results within 30 minutes, but it's not very sensitive. And it's cheap and simple to administer. The thing about quite a few people ask, if I test negative, am I safe? And the answer to this is no, because the test only represents a particular point in time, and it can't tell you whether you're going to be positive in the future. So you always have to continue to follow guidance and take precautions, even if you test negative. And it also means that you might already have it, but you've not just got enough of the substance in your bloodstream to show that you're actually positive for it. Now, in terms of what we're trying to do with vaccination, is it increase your immunity. And we've got the skin is our main armor for our immunity. And then we've got different bits within the bloodstream. There's the foot soldiers, which are the different cells that will fight off some of the infections. And then we've got some really specific ones that are like our elite troops, like the SAS, and they're the white cells and the T cells and the antibodies. Now, why we're vaccinating is so that we can prevent severe disease and death, and prevent the spread of COVID as well. And some of the evidence coming through is that the vaccine will be able to prevent the spread, but we do need to make sure that people continue to use their infection control measures. None of those change. The main aim of the vaccine is to reduce mortality, stop people having to go to hospital, and that's why these risk groups are so important, which our GP colleagues have already informed us about. The way vaccines get developed is quite time consuming and has various stages to it. And the first stage is around we use clinical trials to make sure it's safe, that it works properly, and the right dose, what the right dose is, and how effective the vaccine is in further stage. And then further down the road, we need to find out whether it's always going to be safe. There's questions around how is it that we made it so quick? Is it safe because it's been made so quick? And what we say on that is that red tape was cut so that we are using the same standards that we would normally use, but because it's such a difficult situation, we wanted to get something in place much more rapidly. And there are new vaccines.
Marion, I'm really sorry, but if you could just round it up, we want to get back into the flow of the questions. Okay.
Yeah, sure.
Thank you.
Yeah, certainly. That's fine. There's 3 different types of vaccines available: the Pfizer, the Moderna, and the AstraZeneca one. There's tests being done to find out whether they can be mixed as well. So, but at the moment they'll be utilizing the same vaccine in the first vaccine and then your recall as well. But there's ongoing research to see if we can mix them as well.
Okay. Yeah, thank you for that, Marion. Gemma, could we have another 3 questions, please? And can I ask the panel, Rahul, question 1, Dr. Day, question 2, Peter, Dr. Ingham, question 3, so that you know exactly. Oh, I didn't start my video, let me apologize. And Peter, you'll be doing question 3. So can I go over to Gemma, please?
Yes, so we do have our chief nurse on the call as well, who will answer the question regarding asthma directly. So I'm going to skip over that one. The next one is from Pat Ferrins. She says, my husband had his first jab on the 10th of February. When can he expect to be called for the second one, and will it be the same brand? So that's the first question. The next one is from Clive. Question to Dr. Dubb. Can you tell us which are the neighbouring practices that you've taken on, as well as your practices within the Sutton Coldfield group, please? Does it include the Hawthorns medical practice? And then the next one's from Judy Preston. Hello, I'm not concerned about the vaccine. My mum has both vaccines and we're all very pleased. She has dementia. I'm a full-time carer. My question is about providing the vaccine to unpaid carers. Could we answer that one next, please? That's 3.
Okay. Can you promote the chief nurse so we can ask her question, and we'll keep it flowing. She can also answer after Peter's answered. Okay.
Helen,
so
would you like to turn your video on, please, Helen? Oh, wait.
Is Ellen there?
You should be.
Yeah, my video's on. Can you see me?
Okay, right. So if you just tell Ellen her question, and then we'll get the doctors to answer first, and Ellen will then have time to think and answer her question. Thank you.
Yeah, so Helen's question was around teachers getting the vaccination and also people who've got asthma. There were 2 questions that were very similar along those lines, Helen. Thank you.
Okay. Can we start with Dr. Day, please?
So I think the question was that someone's had their vaccine on the 10th of January. Was that right?
It was the 10th of February, Clara.
Oh, 10th of February. That's next week. So, at the moment, the gap between vaccines is between 11 and 12 weeks. And so we are calling people, if once they've had their vaccine, they will be called again 11 to 12 weeks after that first vaccine. And at this point, we are trying to give you the same brand of vaccine that you had the first time round. So if you had it in general practice the first time round, you will know which vaccine you had, and we'll give you the same one again the second time round. And if you had it somewhere else, equally. At the moment, the larger sites are just giving one type of vaccine. So if you have it in that site, you will have the same one if you go back there again. So I hope that's helpful.
That's great. Thank you very much.
Right, thank you. Can we go over to Dr. Dubb and your question, please?
So I think my question was about the Hawthorns, an inquiry about Hawthorne's surgery in our group. Sutton Coldfield group practice is looking after Ashfield surgery, Manor practice, and Hawthorne's. And the way we're doing that is that each of those 3 sites have an allocation of appointments that they are responsible for booking for according to their total population coverage. So there's an equal split of appointments available between our practice and the 3 sites we're supporting, and each of those sites, because they know their patients, they're booking those in accordance with the groups that need to be called.
Thank you, Dr. Dove. Can we go straight over to Peter? Dr. Ingham, please, for the 3rd answer.
Yes, thank you, Paulette. I think this was concerning unpaid carers and their introduction into the priority 6 or the cohort 6 group, which we know would happen, and we will clearly be wanting to communicate with carers. Practices have lists of carers and they log that sort of data, so hopefully we can communicate with carers in that manner, but we'd also need to work with our communication team to make sure we get the message out more broadly. Can I ask if Clara might be able to comment on this, because I know she said I think there was a meeting recently about this.
Thank you, Peter. So I don't know whether people know about the priority groups. We're talking about these priority groups as though everyone knows what we're talking about, because we've been living this for a long time. And there's 6 that the government has listed groups on which we're currently in groups 1 to 4, which are the Joint Committee on Vaccinations has put together so that they are the highest risk people are vaccinated first. So the first group, group 1, was people who are resident in elderly care homes and care home staff. Group 2 was over 80s and all health and social care workers. Group 3 is people who are 75 to 79, and group 4 is people who are 70 to 74 plus everybody who's in a group called the clinically extremely vulnerable group, which are those people who have been shielding because of medical conditions. We then continue to move down age bands, so group 1 to 4 are which we're being currently asked to focus on, but we're shortly likely to go down to the group beneath. So group 5, I'm just trying to think my maths here, is 65 to 69, and group 6 is 60 to 65 plus a whole group of people who are called clinically vulnerable, who are the people who would normally be called to have a flu jab. And that is what's called cohort priority 6. Now carers will fall into that priority group 6, which won't be long now, I don't think. And as Peter says, we're very keen to have people who are unpaid carers in that group if you have not already been vaccinated because of your age or another condition. So we are working with the councils to make sure that we pick up people who are on any of the carers lists, and we'll also work with general practice to make sure that we pick up people who are unpaid carers. But if you feel you're not called in that cohort and you do fit into that category, then we'll give you some communication as to how you can do that. So I hope that explains that.
Great stuff. Can we have the chief nurse, please, to answer her question?
Hi, good evening, everyone. There are 2 questions from Catherine that I was keen to pick up on. The first one Catherine's asked is, can she have the vaccine if she has asthma? The answer is yes, but again, if you've got acute, if you're suffering from acute exacerbation of your asthma, then you will need to take some advice from your GP. And always, when you go for your vaccination, report in to the person that's vaccinating that you have got an underlying condition of asthma, and they will help and support you at the vaccine centre. The second question from Catherine, which I'm keen to do both, Catherine, you are concerned about children that would normally go to mainstream school, and you've put a question in saying that these children should be in a special school, but there is no space. Well, I'd like to talk to you offline about that, because there's several different answers to that depending on what the child is presented with. I've put my email into the chat, and if you email me across, that would be great. we need to be mindful that teachers are doing their very best to do safe space, hand washing and use of masks, opening windows, etc. in their school environment. And I think what we need to do is help and support the teachers to be able to keep everybody away from everybody as much as they can. The rotas are in place for school, and that includes children in special educational needs. Children with a statement that are in mainstream school are also working with other children and with teachers to try and keep everybody safe and stick to the rules. I've never seen so much hand washing in schools. I don't think ever in my life. So hats off to the efforts that are being made in school. And Catherine, I'm more than happy to take that question with an email from yourself, and I can either call you or email you back. It'd be my pleasure. Thank you.
Thank you for that. Before I bring Gemma back in, I've got some questions that we still haven't had answers to. So I'm going to give Dr. Dove 2 of the questions, and then I'll go to Dr. Day, then Dr. Ingham. Why was the vaccine developed so fast, Dr. Dove? And the next one, why should I get vaccinated if I'm not in an at-risk group?
Okay, first question, why was it developed so fast? So essentially, it's quite a multifaceted answer. So the vaccine was developed in collaboration. All the world was after this single vaccine, and so there was a massive push. And this is probably one of the first in our generation where the whole world has been after that same goal. And so you've combined technologies, expertise, etc. And a lot of the background work that has been done for quite a while, actually. And so where it came to the specifics of the vaccine, then as I think Marion alluded to earlier, was that because there was a real drive, then the sort of I think you described it as red tape. So some of the barriers that were initially there around getting approval, etc., were sort of easily dealt with. So the same processes to assess safety was followed, but to get from one place to the next place to the next place, those red tape barriers were removed, and therefore enabled us to get to the end point quicker.
So Dr. Dove, why should I get vaccinated if I'm not in an at-risk group, please?
Yep. Okay. So I think there is no doubt that here the COVID crisis is something that isn't selective of any one particular risk group. It can affect anyone and everyone. And the key thing here is that we're trying to manage this on several levels, and nobody is immune to it. It is something which we need to handle together through all the public health messages we've had about hands, space and space. But the vaccine itself is the only way we can get through to being protected, to develop the immune system, and to therefore not have any serious consequences from that COVID condition.
Right.
So
but just to remind people, Dr. Dove, they still have to wash their hands, they still have to wear their mask, they still have to social distance. So even with the vaccine, we are expecting people to still follow the rules, because we're not saying that you won't get the virus, but what we are saying is if you do get the virus, the effects from the virus will be a lot less severe. Yes,
absolutely.
Thank you. Absolutely brilliant, Dr. Dove. Can I go straight on to Dr. Day? This is another question I get an awful lot. Why is the vaccine being rolled out before we know its long-term effects? And why can't I choose which vaccine I get? Thank you, Dr. Day.
So we're in a situation where we need to get people vaccinated as quickly as we can, obviously to control the pandemic that we're in and try and get back to some sort of normal life. So the technology that is used, we are aware of longer term studies around this. And so if we were to wait for studies with 5-year outcomes from this, we'd be an awful long way down the line and would be not being able to control our lives for the next 5 years. So as Rahul says, a lot of the studies have gone through very quickly around this, and the vaccine doctors tell us that if there are going to be problems with the vaccine, they tend to occur early rather than as long-term effects. So all the relevant safety studies have already been done, as would be for any other vaccine. So it wouldn't be normal for you to be looking at side effects for a vaccine 4 or 5 years down the line, or even a year down the line. You look for them in that early period of time, and the studies of those have been done. The question about what vaccine you can choose, I think that at the moment we've got 2 effective vaccines going round. There's not much difference between them with regards to any of the side effects, or indeed to how we think they protect people. And we just want to get people protected as quickly as possible and as a straightforward way as possible. If we start to offer choice around vaccine, it becomes very, very complicated when we're just trying to do this massive public health project to protect people as quickly as we can.
Right, that is excellent. Dr. Ingham, I'm going to give you the last 2 questions before I bring Gemma back in, so we get a bit of a mix. How come with less than 90% effectiveness was this vaccine approved? And the second one was, will it affect my fertility? That is a question being asked a lot by the 20 to 39-year-olds. Thank you, Dr. Ingham.
So 90% effectiveness for any vaccine is thought to be incredibly good, and will give great protection to the population. I think the WHO criteria was to have a vaccine that exceeded 50%. So this is far, far more effective and gives greater protection. And that is, I think, what we are seeing as some of the early data comes back about how this is working within the population. So we think the vaccine works incredibly well. The second question, Chair, was around fertility. I believe there's no evidence to suggest this has any sort of impact at all, nor would it, or nor would we expect it to have any impact, just on our understanding of the physiology and how vaccines work. So there is no evidence, and there is no real logic behind why this would have an impact.
I think what happened at the beginning, Peter, was that pregnant women were told to seek advice before having the vaccine. Right. So a lot of younger people then said, yeah, and that's where I think it came from. Yeah. But you're spot on, there is no evidence to say, and even in the information given by the NHS, they are saying you can have it, it doesn't affect fertility, because it isn't a long lasting vaccine. They don't know the length of time, but they're presuming it's something that we will have to keep taking regularly. Yeah. So thank you for those 2 answers. Can I go back to Gemma? Gemma, would you like to give us a few more questions?
Of course. Thank you.
We can also bring Marion and Ellen in if you've got any questions more suitable for them.
Okay, yep. So the next one's from Linda. She wants to know about housebound vaccinations. She says she's received the text and the letter, but she can't get to a centre. So that's one from Linda. The next one is from Tony. He said he was tested positive for COVID on the 1st of January. How long does he need to wait before he can have the COVID vaccine? And then the next one's from Sandra. She's a retired midwife. Her husband is having his COVID vaccine at Shady Lane. He wanted it at Falcon Lodge. Can he change the venue for the second jab? I've heard nothing but praise for Millennium Point. So 3 questions there, thank you.
Right, can I start with Peter this time? Which question are you going to answer? Peter, you're on mute.
Which do you want me to answer?
Number 3.
The third one.
Yeah.
I think that was about whether you can change venue at the moment where you're vaccinating.
Right, Peter, yeah.
I think there has been some debate that this may come about, but at the moment we're sticking to the policy of staying with the venue that was originally booked. It's clearly very difficult for us to make arrangements for people to change. And what one needs to remember is that some venues will be using a particular vaccine at a particular time. So it logistically becomes much more tricky to move people around, although I absolutely accept that people would want to have their vaccines more locally if it were possible.
Brilliant, Peter. Can we go to Ellen, read the question of people at home that have had their letters for the vaccine and at the moment they're unable to get to a vaccine centre. Have you got any idea what's happening with those people, Ellen?
So Birmingham Community Health Trust are doing a vaccination programme for those that are housebound and at home, and that is working well. I think I was quoted last Saturday, they did 32 vaccinations, one all the way round, and then doing hundreds in the days that we've gone by, specifically based on the vaccination supply. So Birmingham's Community Trust are doing that. GPs are also doing their housebound list. And my advice to the Sandra, I can't remember the name, I do apologise, Linda. My advice to Linda is that she contacts a GP directly and make sure that a GP knows that she's a housebound and will fit on the housebound register. And if the GPs won't get round to getting her vaccinated, Birmingham Community Health Trust will seek and make sure that she's vaccinated.
And that's spot on. That is spot on. And can I say they've done over 1,000 people in their own already. That is brilliant.
Paulette, I'm quite willing to again put my email address to Linda in, and I can help and support her with her general practitioner and with the community trust if she'd like to contact me via email.
That's fantastic, Helen. And Dr. Dobb, you've got the third question. Can't remember what that was.
It was from Tony. If Tony tested positive for COVID on the 1st of January, is he okay to have his vaccine now? I think the answer is yes, isn't it, Rahul?
So 28 days from test that was positive. So you've passed that. So yes, you are.
Brilliant. Thank you. Dr. Day, you've got me again. A question that is asked of me all the time. Is the vaccine made from animal products? Are you able to answer that question? You've got your mute button on, Dr.
Yes, I think I should know. There are no animal products in either of the vaccines that we are currently using at all. So
right.
No.
Right. And the next question, and I'm going to ask you again, Dr. Day, can I have the vaccine if I have had the flu jab?
So you can have the vaccine if you've had the flu jab. We just don't like to give it within 7 days of having the flu jab. So if you've had the flu jab over a week beforehand, then having the COVID vaccine is absolutely fine.
Brilliant, Dr. Day. Can I go back to Gemma for some more questions from the chat box?
Of course.
Gemma?
Thank you, Paulette. Yeah, this is from Indy. They would like to know if they'll be eligible for a vaccine if pregnant. Let me just scroll through. The next question is from Colin. Can we be sure that there will be supplies of the same vaccine available for our second vaccination? This is from Reg. He wants to know if this is a one-off event and we will be doing more, and how does it fit in with the COVID champions?
Right. I'll answer question 3. Reg will be doing another 4 of these events. It fits in perfectly with COVID champions. If Marion is on the line, she can explain. So the COVID champions in Birmingham, we've already got over 600 of them. So the last report I had, we had nearly 600 COVID champions. We're hoping to get the numbers up to about 1,500. Every single councillor in Birmingham City Council is also a COVID champion. The idea is we are giving them information to distill and to get out into the community as quickly as possible. So I do know that Councillor Yip is on this call, and I know he's a COVID champion. So we're getting the information out through COVID champions, but these events we felt were needed because of the level of hesitancy from certain parts of the community, and also people wanting to get answers to questions that they've got. And even though they're taking the vaccines, they're wanting answers. So we wanted to make sure that local GPs who you know and you trust and you love, that they were available to you to actually answer any questions you may have. So that's the answer to that question. I hope that's a full enough answer. And then what was the second question? I've forgotten it with all me rabbling on.
Colin was asking about supplies of the same vaccine for the second dose, and then
right.
was asking about if it's safe during pregnancy.
Right. Can I ask Dr. Day to answer the question about pregnancy, and Dr. Dubb the question about the second dose? Thank you.
So pregnancy, so these vaccines haven't been tested in pregnancy because we wouldn't normally do trials in pregnant women and just standardly. But the answer to that is if you have a condition that makes you very at risk from COVID, or you're very exposed to COVID, then what we are saying to people is that you discuss it through with your the people who are looking after you in pregnancy as to whether it's felt that the benefits of the vaccine outweigh the potential risks of having it in pregnancy. We don't think there's any risks of having this vaccine in pregnancy. We regularly give other vaccines in pregnancy like flu and whooping cough. We do that all the time. The only reason we say that with this one is just because it hasn't yet been tested. But we would recommend it, for instance, if you are a nurse working on a ward where you're and you're going to be exposed to a lot of COVID, or you're working in a care home and you're likely to be very exposed to COVID. So in that situation, we certainly would recommend that you have a conversation with your midwife or your obstetrician about it. And if you fall into one of the much higher risk groups, so that I, for instance, look after people with kidney transplants who are pregnant, they're at very high risk because of other reasons, or if you're a severe asthmatic and you're pregnant, then you may well again want to have the conversation with your midwife or your obstetrician about whether the vaccine would be suitable for you. So it's not that we're not saying that ladies who are pregnant shouldn't have it, it's just that they need to have an additional conversation. It's also absolutely fine to breastfeed and have the vaccine. And if you fall into an at-risk group and you therefore you decide you don't want the vaccine whilst you're pregnant, you can then have it as soon as you have had the baby.
Thank you. Dr. Dubb, I think, the third question.
So the question was about supplies and second dose following first dose. So the plan is very much towards the government having already known who had what vaccine first time round, to allocate 11 to 12 weeks after that dosage the second dose of the same vaccine. So there is a plan in place, and we're being told that centrally from NHS England. So yes, that's the plan.
Thank you, Dr. Dubb. Gemma, over to you again. Have you got some questions for us?
Yeah, I can. Well, it's not a question, more of a statement, really. Quite a few people in the chat have been talking about the scams that have been going around that are trying to dupe people into parting with their money or their personal information. It's just really important to say that people need to be very careful with that. There's one doing the rounds at the moment, and it sort of states that they are looking into your ethnic background, and the NHS has selected you to have the vaccine. That is fake, and we would really like to remind people that they shouldn't be parting with any kind of money, putting in their bank details or anything like that. The NHS will never ask you for payment. So just to be very vigilant around that. Councillor Alex Yip has made a comment around the NHS not texting people. Well, actually, Councillor Yip, we do text people about appointments. So it could be a phone call, it could be a text message or something through the post. But we would just urge people to be really cautious, and if they do have any kind of doubt about it, then obviously double check it with the 119 National Booking Service or their own GP practice. I think that would be the advice we'd like to give to people. Next question, if I scroll down, from Pam Whittington. Is James Preston included in the Sutton Coldfield group practices, Rahul?
Yep, so I can just confirm the way, so James Preston is the name of the building, and there's two practices that sit in that building: manor practice and easy practice. And VZ practice is part of Sutton Coldfield group practice. Manor practice isn't. However, we're looking after both for the vaccination program. So just for completeness of answer, Sutton Coldfield group practice comprises of surgery, Four Oaks Medical Centre, Tudor practice, VZ practice, Sutton Park surgery, and Falcon Medical Centre.
Thank you. So the next question is from Tony. Tony's daughter has a blood condition and has received chemotherapy. She's still having treatment and has been invited to have the vaccine, but we are unsure if it is safe. What would your advice to Tony be?
Right, I think Dr. Ingham, I think it's your turn. Thank you.
Yes, the vaccine would be safe. I think it is likely that your daughter would need to get agreement from the specialist that is looking after her to make sure that they're happy that she can be vaccinated. But we feel that the vaccination will still be safe and would offer her protection. So yes, we would encourage it.
Right. Gemma, have you got another couple of questions? And then I've got my last two to pose to the panel.
So yeah, I'll do another couple. So the first one is around students requiring the vaccination, and the second one is around a date for priority groups. So if you are 59 now but will be 60 in May, then if all of the 6 groups are not completed by my birthday, I would be in effect fall into group 6 or group 7. So that's essentially someone's age now versus what they might be when they're eligible for the vaccination.
Dr. Day, would you be able to answer this one?
About the ages?
Yeah.
So certainly. So we're going through this vaccination program will still be going in May, I think, I'm sure. So even if you're not called originally in Priority 6, we are continuing. So we don't ever lock off a cohort. So if we're saying that we've done cohort 1 first at care homes and then, the over 80s, there are people all the time who are not able to receive a vaccine in that group because, as we've said, if you've just had your flu vaccine, if you've been in hospital and poorly, or if you've had COVID within the last 28 days, you can't have it. So all the time, if you're not able to have the vaccine when you're called, you will be recalled to see if you want it at another time. And that will happen equally as we go down the age groups. So if because of your birthday you missed the cutoff the first time round, you will be called in again. But in reality, we're likely to be going down those cohorts anyway, so that you will be picked up, because the first load that we're going down to is over 50. So that's the first phase of the programme. So even whether you're 59 or 60 at that time, you will be called.
Thank you, that's really good. I'm going to ask a couple of the common questions that I get asked again. Can we force people to have the vaccine? I'm going to ask Dr. Dub, read that one. And the second one that I, for some reason, get asked quite a bit. No, let me not ask that one yet. Dr. Rahul, could you answer that question, please?
We're not in the business of forcing anyone against their will. That's the first statement to make. But we can advise, and strongly advise, based on current evidence and based on the condition we're trying to protect against. So I would say that we would strongly advise the vaccine and make sure the person we advise understands the pros and the cons. And currently, the pros far outweigh any side effect risks. So we would strongly advise that you have the vaccine. And if there's any doubt, then your practitioner GP will be more than happy to talk you through that, I'm sure. But we would say that you should have it.
Can I just add to that, because you're so right? You should have the vaccine unless advised not to have it. But what we're not, we're a democratic country. And I want to say to anybody who's on the call, just to back up what Dr. Dubb is saying, what our doctors have been doing, and they have done a phenomenal job in primary care. They have been going back to their residents, and if the residents say no, they leave it for a little while and they go back again. And they've been doing this continuously. Sometimes it's quite time consuming, but they want to make sure that residents are confident that they're taking this vaccine for the right reasons. And I'd just like to say on this call, they have done a phenomenal job, to the extent where I've gone and got my number back, Peter, and I'm now going to be giving vaccines if that will help. But at the end of the day, that's what we're here for. We're all here to help each other, and I cannot encourage people enough to please take the vaccine or ask the questions. I'm going to go straight back over to Gemma. Have you got any more questions in the chat box for us?
Yes, there's one from Sandra regarding mask wearing. She feels that lots of people don't wear the mask properly, and that we need more guidance for the public, e.g. don't touch your mask, etc. And what would our thoughts be around that, really? Well, I know from a communications perspective, we do an awful lot with the hands, face, space call to action, and I know the councils do, and the other NHS organisations do as well, and I know that that's been doing the rounds for a while now. I'm not sure if anyone's got any other suggestions about what we might do about that.
I think, Gemma, Sandra also asks questions about schools, about children wearing masks in schools and about children wearing masks in society. So I've done my best to answer that to Sandra, to say I think it's very difficult for children to wear masks. It's not difficult for older teenagers to wear masks, but it's certainly difficult for children to wear masks. So the push with children is space, hand washing, cleanliness, and recognising that they need to keep that hygiene up, both at home and in school and when they're with their friends. So I think this is set for life, and if we can continue to encourage children to persist with good hand hygiene, that would be good. I think for masks, the message is masks are what we've got. It's what we've had for quite some time now. It's what we know, and we've got a global response with the mask wearing. So whether the mask has full protection, it's about how you correctly wear the masks, how you wear it inside buildings, near people, but the social distancing. So the three things together are absolutely imperative: hands, face, space, and the communication we need to do and encourage other people to do that is paramount. And only with the hands, face, space and vaccine will we conquer the COVID-19 together.
Fantastic. We have got somebody that I respect a great deal, and he's on the line at the moment. Well, I hope he is. And it's unfortunate that Marion has had problems with the with her overheads, but Justin's on the line, and if he's able to come in, it would be really nice for him to spend a few minutes and just talk a little bit about variants, because I know people worry about this, and he will really put your minds at rest, and to show you all that we are working as one team to ensure that we keep any variants away from our residents as much as possible in Birmingham City Council. Justin, are you still with us on the line?
I am, Councillor Hamilton.
Oh, fantastic. Come on then, Justin.
Okay.
Do your thing.
Hi, everyone. Apologies, I couldn't be with you for most of tonight. The issue at the moment is what are called variants of concern. So viruses change all the time. It's a perfectly normal part of viruses. Sorry, and most of those changes actually mean that the virus gets weaker or doesn't make any difference at all. However, in some cases, the virus either becomes more infectious or it becomes more deadly, so it puts more people in hospital, kills more people, or it changes in a way which means the vaccines are not as effective. And if it does any of those three things, we call it a variant of concern. Now, around the world, there are 4 main variants of concern. There's obviously the one from Kent and London that we all lived through before Christmas. There's one in South Africa, one from Japan, and one from Brazil. Now, in general, when we identify someone with a variant of concern, if they're linked back to travel, we know where they got it, they came off a plane with it, then we don't do anything additional. But where we find people that are identified with the variant of concern and we can't find that connection to an aeroplane, that's where we're doing the additional testing. And that's the thing that the Secretary of State called Operation Eagle earlier this week. Now, across the country, there are a small number of cases that have been identified where we know people have got the South African variant, but we can't quite connect them to an aeroplane to know that's where they got it. And at the moment, we now have some cases in the Frankly Great Park part of the city. There are also cases in Walsall, as well as being in Surrey and Bristol and Liverpool. And in those areas, we're now rolling out testing for anyone that doesn't have symptoms to go and get a test through one of the designated sites. And that's so that we make sure those testing kits go back to a specific laboratory where we can give you a result in about 2 days, but we can also do the genetic testing, and that takes about a week or 2 to come back in this special lab. So it won't make any difference to you if you do test positive, but it's more that we can work out what the missing bit of the jigsaw is. So as of today, we have a testing site open at the St Modwyn site on the Longbridge Business Park. We will be opening additional sites on Saturday. I think we've done over 650 tests today and the site kind of ran out of kits. So tomorrow there will be double capacity there, and then we will have more sites opening over the weekend. Now, it's important finally to say new variants will happen. This is a normal part of viruses. We knew it was going to happen. And this one is more infectious, but there's no evidence that at the moment it kills more people or that it causes any more problems for the vaccine. Now, there is some research going into that it may make the vaccine slightly less effective, but it still works. And the difference is not really big enough, I think, to make much difference to what we're doing at the moment. So if you do live in that part of the city, as of tonight, there's now a postcode checker on the council website. There's loads of frequently asked questions as well. So if you live in Northfield or Frankly Great Park, go on the website, put in your postcode, and it'll tell you what you need to do and where to get a test. And we'll be doing this enhanced testing over the next 10 to 12 days while we try to reach about 10,000 people across that part of the city and find those missing bits of the jigsaw that will help us get this under control.
Thank you, Dr. Varney. Thank you, Justin. Can I go straight back to Gemma? Have we got any more questions?
Yeah, I've been emailing with somebody called Debs. She's concerned that her son has been contacted when he's not in an eligible group, and she feels because her son, sorry, it's Dawn, not Debs, apologies, because he's black, that is obviously playing into some kind of issues that may be out there. But without further details about the individual, I've said to Dawn that, you know, we're very happy to look into it for her if she's able to provide appropriate consent and some more details about her son, Paulette. Okay.
Yeah, that's fine.
So from Debs, so she wants to know about spreading the virus. So she says, why does it state you can still spread the virus and catch the virus? If you've had the virus, then you are immune to the virus. So she's very obviously a bit confused about how you can pass the virus on. If anyone could answer that one, maybe.
Do you want me to hand that to Dr. Varney, or would want?
Yeah.
Justin, can you answer that question, please?
Thank you to my clinical colleagues. So there are a couple of things that are important to understand, Deb. So first of all, when you have the vaccine, it takes several weeks for it actually to do its business, to teach your body how to defend itself. And in most people, that's between 1 and 3 weeks. It varies a bit between all of us because we're all slightly different. And what the vaccine's doing after the first dose is it's giving you some protection, but it's not 100% effective. No vaccine is 100% effective. But we do know that after the first dose, it massively reduces your chance of dying or ending up in hospital. And it really is impressive at the reduction in terms of the benefit for that. After the second dose, again, another 2 to 3 weeks before we're sure that it's actually working. And that gives you depending on the vaccine, between 70 and 95% protection. And what's that doing is that stopping you getting infected. Now, what we don't know yet is when you've had the vaccine, if it super primes your immune response, so that if the virus lands on you, you jump to defense and you kill it straight away. And that's called sterilizing immunity. And we don't really learn about that until a lot of people have been vaccinated, and we can really see that in the field. What we do know is that once you've had both doses, after a couple of weeks, you will have protection from becoming infected from the virus, but we're not 100% sure it will stop you spreading it. So you still have to do hands, face, space. Now that may change as we learn more, as more people get vaccinated. And there's a lot of work looking at the moment about that, but it is important to recognize, things don't change the day after you get your vaccine. And even after you've had both doses, you could still spread the virus if you're not washing your hands. And, Helen was quite right early on. It's not just kids we need to teach to wash their hands. If you see any of the research on peanuts on bars, it's quite horrific how bad, particularly men are at washing their hands. So it's a good reminder all of us need to keep that habit going, even long after COVID's away, because it's a benefit to all of us.
Thank you for that, Justin. Can I ask the panel, it sounds silly, but to go back to the question that Dawn asked about the issue of her son being targeted for the vaccine and what that means. Is it possible, Gemma, to get Dawn to ask the question herself? Dawn, are you still on the line?
Yes, I'm still on the line. Thank you, Paula. I really appreciate that.
Yeah, would you mind asking that question again, please?
Okay. Paula, you know that I'm a strong advocate in the community. Yeah. I support, healthy issues across the city. I'm an influencer. Most people take my advice, and I would advise anybody to take the COVID vaccine. I'm not an anti-vaxxer. I don't believe in, conspiracy theories or any of those things. However, when the vaccine was rolled out, my mum is over 70. She's got underlying health conditions. I'm over 50. I don't have any underlying health conditions, but you would have thought that I'm still in that kind of group. I work in the communities. I'm a frontline worker. Out of everybody in the whole family, the only person who got a letter from the NHS was my son, who is 27. He's young, he's healthy, he's got a body fat of probably minus 15. He's got a six-pack. He's not obese or unhealthy. He's got no underlying health conditions or anything. And it became a joke at first within our family that he was the first person to get the letter. But as he's spoken to his peers, other young people, and he said, well, I got the letter and everything, it plays into this stereotype amongst young people that young black men are being targeted as guinea pigs, and this isn't very helpful. We need to address this, and we need answers as to why he was targeted for no apparent reason other than being black.
Is anybody able to answer that? Justin, you're normally quite good with things like this.
So, I mean, I think what I'd say, Dawn, is clearly something's gone wrong. And the reality is that, you know, the NHS, huge engine, and despite the best efforts of many of my colleagues, there is a kind of computer software program that generates the letters, and it's extracting off the GP record. So what's most likely happen is on his GP record, actually his date of birth's been incorrectly entered. So when the search engine just goes through, it thinks he's over 80 for whatever, probably a typo, frankly. And what I'd suggest is if you drop a line to Gemma afterwards and send a picture of the letter, then actually we can flag that up the system, because like anything else, I mean, there's millions of these letters that are being churned out by the computer. There will be mistakes. And that's unfortunate, but as you say, it's really important we do pick it up, we do work out what's gone wrong, because we don't want to give the wrong message. We don't want to give the impression that in any way the system is singling out young black men. There will be a time when young black men are eligible for the vaccine, like young white men and young Asian men. But as you say, he sounds perfectly fit and healthy, and he's probably going to outlive all of us at this rate. So, you know, he can sit tight and wait for a little while, and someone who's over 80 or over 70 should be getting it first. But if you can send through the picture of it, then actually the NHS colleagues will be able to track down and actually work back through to the system, because it might be that there's a simple error actually on his GP record, and it's a good time to find that out and get it fixed. But really don't, to people watching, there is no malicious intent or anything behind it. I strongly suspect it's a typo on his record, and actually let's get that fixed, because it's important when he gets a bit older for things like screening that his age is right. Also, because at some point someone will look at his record and go, expect to see a 90-year-old man walk in the room, he'll walk in the room and they'll all get a bit confused and go, where's your granddad? So that kind of thing, if it happens, let the NHS know, because it's...
Justin, thank you for that. Right, I'm going to ask my last question, and then I'm going to hand over to Gemma for any more questions. Can I have the question? I have only asked you questions I get asked a lot. So can I have the vaccine if I've already had COVID-19? Dr. Dub, are you able to answer that one? Thank you.
So yes, you can have the vaccine if you've had COVID-19. We do ask when we administer the vaccine that we leave a gap of 4 weeks from the time of the diagnosis of COVID-19 to having the vaccine. So if it was more than 4 weeks ago that you had COVID-19, then you're absolutely eligible for the vaccine, and that would offer protection. So yes.
Thank you. Thank you very much, Dr. Dub. Gemma, can I go back over to yourself?
Sure. So this one's from somebody's Galaxy phone. And they've said, can I just say that the most elderly Asian community is willing to have the vaccine, but their gatekeepers, e.g. their family members, are preventing them from getting the vaccine. They would like to know what we can tell them today to take back to the community to encourage them to put their family forward for the vaccine. Who would like to answer that one?
That's quite a difficult one. I am going to be really... I think we should share that between Dr. Dub and Dr. Varney, because Justin will have had a lot of these, and Dr. Dub, I'm doing it by the fact that you understand the community. So if we could start with Dr. Dub, and then if Dr. Varney can pick up anything Dr. Dub misses, that might be the best way to go about it. Thank you. Over to you, Dr. Dub.
Thank you. I think it's a very, very important issue, first and foremost, and something that we need to get right with a very strong message that this vaccine is needed for all communities and those that are vulnerable, and to get the vaccine in people's arms. So it's not selective by race, by colour. It is something that we have to get into people that are vulnerable. So if your family member is vulnerable because of their age, they need to have the vaccine. So there may be different levels of rumours and myths amongst different communities, and I would encourage every single person on this call to question, if they've got doubts, question those doubts and ask the health professionals, ask the COVID champions, really absolutely access the support For me, as obviously of Indian origin, I've heard rumours amongst family members, but they are absolutely well within the right to ask the question. But when you actually explore it, there is no alternative agenda. There is no DNA altering of this vaccine. It's absolutely safe. From the studies they've done, I would absolutely encourage it. And there's lots of resources on CCG websites and should be on practice websites. I would encourage practices to put in different languages in which they can answer the questions about the vaccine. So I would implore you all to ask any questions that give you doubt. Ask the people that would know the answer.
Thank you for that, Dr. Duff. Dr. Varney, do you want to add anything?
Yeah, sorry, I was playing the game of mute, unmute. Those of you who caught the news before this will have seen me uncharacteristically stayed mute while talking to the BBC. So I think that the point I just add to build on Dr. Stubbs' point is we are offering people the vaccination who are most at risk of dying or ending up in hospital if they catch COVID. Many of our communities have been disproportionately hit by deaths. When I look on social media, the number of deaths in our Asian community, in African and Caribbean communities, many of our families have had deaths in their communities and people they know and are still reluctant. And I'm very grateful to our faith leaders in the city who've been very vocal about saying all of the vaccines are approved by all of the major world faiths. As you've seen, we've got one of the mosques has set up a vaccination centre. There's a Sikh temple in one of the neighbouring areas as well. I'm sure we will have a Gurdwara before long to complete the set along with a church. So, actually from a religious point of view, it is acceptable. We have seen some of our most esteemed Muslim clerics and imams across the city take the vaccine themselves, as well as our Sikh and Hindu community leaders. And that should give people reassurance. If those people are taking the vaccine and saying publicly, I've had the vaccine, they're not doing it because they want the glory of the Twitter fame. They're doing it because they want to try and provide reassurance and confidence that this is safe. I've had the vaccine because I've trained as a vaccinator now. I know that Councillor Hamilton's talked about her parents having the vaccine. My parents have had the vaccine, and I have to say, the sense of relief that I felt after they had had their first dose, I got pretty emotional, I have to say. Both my parents are elderly and getting more frail. It meant a lot. It meant a lot to have that burden slightly reduced, that they might still catch COVID after the first dose, but I'm now very confident they won't end up in hospital or die if they do. So I would say to any of those family members that are holding back your grandparents or your parents, think about actually what you're doing. You're stopping them getting the injection that will prevent them dying or ending up in hospital if they catch COVID. It's not perfect, nothing is, but it does make a big difference to their chance of ending up in hospital. And frankly, most of us just want to see our parents for as long as possible, as well as possible. So please don't deny them the chance to live to see another year because you was too scared. Follow what the leaders in the community are doing. Follow the scientists, the doctors on this call, most of who I'm sure have already had their vaccines as well. We're scientists, we're not stupid. We wouldn't put ourselves at risk if we thought it was dodgy either. We've got in there because this is the right thing to do to save lives. And please put your parents first, put their lives first, and support them to get their jab.
Thank you so much, Justin. That's really helpful. And yourself, Dr. Duff, because I know I'm with Justin when my parents had their jab because they said no at first, and I was so angry. I don't think I've ever been as upset, Justin will tell you, as I was when they told me they had refused the phone call and told the doctors, give it to somebody else who needs it more than us. My mom's got arthritis, my dad isn't well, and I just thought, I'm not having this. So I literally, I wasn't very happy with them, but I can report that my parents have had the vaccine, and I have to say I had a little bit of a dance around the house when they had the vaccine. So Justin is spot on and Dr. Dove is spot on. Family members need to get the information so that they can give the right advice to elderly relatives, because many of our elderly relatives, they don't say no on their own. They're stalwarts, and if they are asked to do something, they will do it. The only time they don't do it, it's because sometimes they're encouraged not to, and this is why lots of the education needs to go on with the younger people between the ages of 20 and 39, because they're the ones that are influencing the older ones. So I'm really pleased that question came up. Gemma, have we got any more questions? We've probably got time for 2 more questions.
So yes, we've got 2 more questions. So the first one is around effectiveness. So Gabe wants to know, what does 90% effective mean? So if someone could explain that in a bit more detail. And the second one is about more of a comment really about the impact on people's emotional, mental well-being, and you know the impact it's on having on everyone. I can answer that one by saying in Birmingham and Solihull, we're very fortunate to have a 24/7 mental health support offer that's open to everybody, and I've put the link to the details of how people can access that support in the chat. So I would encourage anybody who is struggling with their mental health to give that line a call and seek some support, because it's an excellent service, and you know, people do need to reach out and get help if they need it. So please access the details and the link I've put in the chat. But going back to the 90% effectiveness question, is that another one for Justin maybe? Am I?
Yeah, I would give that one to Justin. He's here now, so we're going to work him. So Justin, over to you, that 90% question.
Thank you. This is what I get for being late. So all basically the 90% is that it gives you that there's kind of, if you took 100 people and gave them the vaccine, 90 of them would get full protection and 10% we're not confident they would get full protection. No vaccine is 100% effective. So the flu jab that we give people every year, that's estimated between 40 and 50% effective in terms of giving you full protection. So really what it is, it's giving you a sense of roughly out of 100 people, how many would get really, really strong protection. We think that the majority of the remainder will still get some protection, but it just won't be perfect. So it's not saying that remaining 10 people have nothing. They still have something, but it's just not as good, whereas the 90 have the really strong version. So that's why we use this language. I mean, it is confusing, I understand that. And people look at it and they go, well, you know, the Pfizer one's got a higher percentage than the AstraZeneca one. Am I better asking for the AstraZeneca one? As I said, both of them are well above what we see with the seasonal flu jab. So my advice is take whichever one you're offered and take it as soon as you're offered it. You know, this is the time to get the jab, because the sooner you have it, the sooner you're protected, the less likely you are to die and end up in hospital. And I just remind people, you know, the death toll in this city is now approaching the number of people who died during the Blitz in Birmingham. That is a horrendous number of people we have lost. The sooner we put these jabs into the arms of people who are most likely to die, the sooner that number stops there and it doesn't become a higher number and a more horrendous legacy for the city to live through. So please take the opportunity, whichever one of the jabs. They all work, and they all work better than seasonal flu. So you're off to a winner for that.
Thank you, Justin. I'm just going to go along to the panel to say their last closing words, and then we'll end this webinar. Dr. Dove, would you like to say a few closing words?
Yeah, thank you. Look, first of all, thank you very much for having me here. I can emphasize and re-emphasize till I'm blue in the face, the vaccine is our way out of this, but it still needs your absolute vigilance on hands, face, space. Please follow the guidance. And if you've got any doubts about the vaccine, please ask the right people the question to get that answer. And we would be more than willing as health professionals to help clear any doubts at all. So that's my last statement for the night.
That is excellent. Ellen, would you like to say a few closing words?
And my closing words would be just be kind to each other and kind to the people that are helping to support you. Healthcare workers, teachers, council workers, everybody that's out there, try and be kind to each other. And by being kind to each other, that means helping out to spread the word about taking up the vaccine and hands, face, space. Thank you.
Gemma, you've been an absolute star. Would you like to say a last few words?
Yeah, just to say, support, the hands, face, space. It's going to be really important. Please, have a look at the website links that I've put in the chat. Please follow us on social media, because we put a lot of information on social media if you're able to. And please tell your friends and family about the events, because we'd like lots and lots of people to join and hear from our fabulous colleagues on the panel. Thank you.
Brilliant. Can we have Dr. Day? Would you like to say a few closing words?
I don't think I can say it any better than Dr. Dubb has, really, that, take the vaccine if you're offered it, but keep with the hands, face, space at the moment. But also just North Birmingham should be proud of themselves, actually. You've got a really good uptake rate of the vaccine in the population who've been offered it so far, well over 80%. So, keep up and keep spreading it to all your friends about taking it as well.
And Marion, would you like to say, I know you've had problems with your internet and the laptop and everything, but would you like to say a few last words?
Thank you. I would just say the best way that we can maintain our health is to make sure we ask those questions of our friends. Are you okay? And ask that again to really get the answer, so that we can support each other's mental health.
Okay, thank you, Marion. And Peter, you have got the final word, not unless Justin wants to come in with another final word.
A lot of it's already been said, Paulette, but I'm very proud of all the efforts we've made to vaccinate the population so far, and we will continue to press on and work to vaccinate as much of the population as we can. I would encourage everybody to be vaccinated, and to encourage all of their family and friends to undertake this as well. This is our route back, I think, to getting our lives back, the lives that we remember a year ago. And I can't wait, and I'd love everybody to do that.
To the panel, I'd just like to say thank you all so much. It's been a really, really informative evening. I have thoroughly enjoyed all your inputs. I've enjoyed, you've kept to the point, which has helped me as the chair, but more so, you've given an awful lot of information in this last hour and a half. I can't thank you enough. So on that note, we've got another 4 sessions to go. The next one is on the 9th of February. I'm asking everybody, tell your friends, tell your family. If there are things you need to know, let us know. And by all means, at the next meeting, I will ensure those questions are asked. And on that note, I'd like to say thank you to everybody for coming online and for joining us in this debate tonight. Thank you all, and have a good evening.